If I can convene us, because we want to stay back on schedule for everybody who's on remotely. So welcome back, everybody. For those of you who are just joining us, particularly online, my name is Sandro Galea, and I have the privilege of serving as Dean of the Boston University School of Public Health. And on behalf of our school, welcome to this public health conversation. Thank you to all our presenters, participants for a really interesting session this morning. And as I summarized this morning, we're now going to move to today's second theme, safer cities. How do cities become better and more equitable environments in which to live? Thank you to everybody online and in person who is here for this conversation. I'm going to turn this afternoon session over to our moderator, Professor Loretta Lees. Professor Lees is Director of the Initiative on Cities at Boston University, which is our co-host of this event. She's internationally known for her work on gentrification, urban regeneration, global urbanism, urban policy, urban public space. She has written many books. Her most recent is Defensible Space on the Move, examines the policy mobility of urban housing redesign that purports to inhibit criminal behavior from the US to the UK. Professor Lees, over to you. Thank you for joining us.
Thank you. Welcome, everybody, this afternoon. Thank you, Dean Galea, for your introduction. So it's my pleasure to be moderating this afternoon's session. Safer cities. How do cities become better and more equitable environments in which to live? So a quick note about the event's format before introducing the panelists. After all of the speakers are presented, we're going to have another kind of moderated discussion like earlier. I think we're going to stick possibly to taking questions from the audience again. If you'd like to ask a question, just raise your hand and they'll pass a microphone around. And yeah, so I'm just going to start with a couple of comments as an urbanist. Okay, so how we describe and manage cities can be a matter of life and death. And of course, with COVID, it literally became a matter of life and death. In recent times, we've played with monikers like the sustainable city, the healthy city, now the caring city. But the reality is that we are all still failing, I think, to support life in cities in an equitable and inclusive way. So in a nutshell, I think that kind of instigates what we're going to be talking about now. So over to introducing the speakers. So let me introduce our first speaker, Dr. Karen Chappell. Dr. Chappell is the director of the School of Cities at the University of Toronto, where she also serves as a professor in the Department of Geography and Planning. She is a professor emerita of city and regional planning at the University of California, Berkeley, where she served as departmental chair and held the Carmel Friesen Chair in Urban Studies. She studies inequalities in the planning, development, and governance of regions in the Americas, with a focus on economic development and housing. So, Dr. Chappell, thank you.
Thank you so much, Loretta, and thank you for the kind invitation to the School of Public Health at Boston University, where I used to come for my violin lessons 40 years ago. It's kind of funny to be back like this. So I want to talk about housing. I want to talk about the relationship between housing, health, and equity. And the relationship between housing and health is actually now very well established, thanks to a great number of studies over the past 20 or 30 years. There's a lot of literature on housing as a platform for well-being. There's a ton of work on the social determinants of health, looking in particular at neighborhood quality. I argue that there's not enough attention paid to stability, to the idea of stability, community stability, as one key to health and the ability to thrive. And I know, actually, I'll give you a preview. This is going to relate directly to what Bernadette's going to talk about in a moment. You know, having a place to come home, having a place to experience joy. Those types of experiences are really key to health, and both physical and mental. So I'm going to talk briefly about displacement first, actually. The issue of forced displacement, the issue of voluntary relocation to the suburbs and what that means for health and equity. And then I'm going to talk briefly about data and our issues with data when we study housing and health. And then I'll speak very briefly about policy, what we should do. My research lab is called the Urban Displacement Project. It's still at Berkeley. It's moving to Toronto, so we're about to be international. But we work on evictions and displacement. So you could think of evictions, as being forced to leave by the landlord. We call that a hard eviction. But actually, that's just the tip of the iceberg. Most displacement occurs from what you might think of as soft factors: a raise in rent, landlord harassment. Oh, I'm going to raise the rent next year, by the way, or just poor housing quality, not maintaining the plumbing and this sort of thing, making the place unlivable. So both hard and soft evictions, whatever way it happens, has health impacts. So after being displaced, residents are forced to make very difficult trade-offs when searching for new housing, and these impact their health. And some examples of those trade-offs that they make: you may have to move into a housing unit of lesser quality. That has implications for health. There could be pests, mold, allergens, exacerbation of asthma, and so forth. Another trade-off that people make is moving into crowded units. So crowding negatively impacts mental health. It increases the risk of exposure to respiratory and infectious disease, and so forth. And then the third trade-off that people make often is just paying more for rent. And often when you pay more for rent and you have a fixed household budget, you cut down on healthy food, you cut down on healthcare and medications, you cut down on childcare, other types of factors that are really critical for health. Also, after being displaced, households tend to move to neighborhoods with fewer resources, fewer job opportunities, more distant from work, costly commutes, more environmental hazards, safety concerns, fewer healthcare resources, fewer nonprofits, and so forth. So displacement is traumatizing for families, and I think we really have not spent enough time really exploring those health impacts. In terms of voluntary moves, I think there's also kind of a misconception of the opportunity that low-income households experience when they move to the suburbs. So there's this idea that suburbs are high opportunity areas. And a lot of this is coming now from the work of Raj Chetty, whose brilliant work has shown the upward mobility that comes from moving to the suburbs, looking at the zip code level. And I don't dispute that work, but there's also a number of studies, and a lot of this work comes from the early moving to opportunity studies, looking at folks moving out of public housing projects into the suburbs, using housing vouchers. And often in terms of health, those outcomes were actually not that positive. So often the asthma or mental health conditions, depression, fear, anxiety experienced in public housing were just replicated in a different form in the new suburban neighborhoods that they moved to. This is from the Hope 6 panel study for those who are curious. In general, there's no improvements for hypertension, physical mobility, asthma, et cetera, after you move to the suburb. And there's also mental health issues particularly among adolescent males that have moved from the city to the suburbs. There are mental health improvements for adults, and there are other benefits, but I'm just focusing on health. So in sum, the suburbs don't really seem to be the panacea that a lot of our policies are kind of making them out to be. And so we often justify the redevelopment of the center of the city for higher income users with the idea that fair housing will be in the suburbs. But that I would argue that actually fair housing opportunities may be just as prevalent in this core of the city as in the suburbs, particularly from a health perspective. So a couple comments on data and policy. So when I realized I was coming to speak at a school of public health, I have to confess, I am so jealous of health researchers because of the administrative data you have, because of the individual level data that you have. So you understand individual health histories, and more we can make individual health diagnoses based on individual health histories. Well, guess what? When you're studying housing, you don't have individual data. For the most part, you know about neighborhoods, you know about census tracts or block groups, you know about groups of 4,000 people. So imagine trying to make a diagnosis for stomach cancer based on an average of 4,000 people in a neighborhood. That's what we do with housing data. And so in many ways, housing policy is still in the dark ages, until we can get individual data so that we know which individuals are living in which types of units and what their outcomes are. We won't know much about housing, and we won't know much about how health, and we won't know much about how they're related. So this ecological fallacy, as we call it, this study of urban phenomenon using aggregate units has really held the field back. And I think I would like to see more collaborations between health and housing researchers to really address that and move that forward. And I'll just wrap up by talking a little bit about policies. So because we don't have good data on housing and individuals, we're not really making good policy. We just did a review article on anti-displacement policy, and we looked at 40 different housing policies and their potential to reduce displacement. So guess what? There's no evaluation at all of any of these policies in terms of their effectiveness of mitigating displacement. Nothing. Okay, we don't do evaluation in housing. It's kind of shocking from a health perspective. So this means that we really don't know what works. We don't know what works best in which context. And we're operating in the dark. So then, Barbara spoke earlier about mistrust, institutional mistrust. Well, think about your local housing departments and what how they're making policy. I mean, at least we had some data on vaccines that emerged over time. We don't have the data on housing outcomes in that with a few exceptions, but in general that is out there in the public realm that can be relied on in particular contexts. It doesn't exist. So our local policymakers are sort of making policy in the dark. So I'm looking forward to a new generation of housing policymaking, housing research, working in tandem with health researchers. So thank you very much.
Thank you very much, Karen. That was wonderful. Okay, so we're now going to hear from Ms. Bernadette Merikla. I hope I pronounced that. Is that Miracle? Brilliant, Miracle. Executive Director of the Roadmap Project, a joyful intersectionalist that always leads with race. Her work is centered on a guiding question that ponders just exactly who the offspring of King Cotton and Queen Sugar could be if trauma were not at the core of that child's existence. As Executive Director of the Community Center for Education Results, the backbone organization for the Roadmap Project in Washington State, Bee's work has focused on setting the conditions for cities in the region to fully and joyously provide opportunities for Black and Brown genius to thrive. Over to you. Wonderful.
Good morning. Well, afternoon. It's morning still back where I'm from, but it is such a pleasure to be here today, and I really am truly honored to be amongst these really wonderful panelists talking about health from very different perspectives. So I'm really going to throw you for a curveball because I am the resident woo-woo person everywhere I go, and my space right now is going to be an invitation to you to meditate with me and to think about what is possible. So the intro question is not a rhetorical question to me. It is actually the question that we take to the city council meetings that we attend, to the regional meetings that we attend, where we say, a lot of times when we're looking at Black residents, particularly in the South King County, Seattle region, we're looking at them from a space of trauma. What is the trauma that has happened, particularly in the COVID pandemic, where there were, as everywhere else, disproportionate impacts on Black communities and communities of color in general, in regards to how they were experiencing the pandemic. Everything from it was really great in a very tech innovative kind of space to say, hey, we're going to go do education online and we're going to give 1-to-1 devices, 1-to-2 devices in a lot of spaces in a lot of our districts to students. And that'll be fine. That'll be the fix for education, only to see that most of the Wi-Fi hotspot dead zones in our region existed, as you might imagine, in certain zip codes and with certain populations of our community. And so rather than look at it from a space of how can we just look at what is not working in these spaces, our communities asked for us to center community and to lead with race in a lot of the conversations that we were having. So in the midst of a pandemic, rather than just saying, okay, we're going to set up vaccination clinics and we're going to set them up at the places where we already have public health offices, we really partnered with our nonprofits to say, where are the places that people who are disproportionately impacted by this pandemic are living and have less access because the light rail stations have not been built in their communities yet. The buses are not running in those spaces, and the requirements to even get on a bus during our pandemic are disproportionately impacting the communities that we needed to go to. And so the general gist of the work that we do, particularly in the Roadmap Project, which encompasses the south end of the Seattle Public School District and much of the kind of suburban school districts south of that, all the way up to Olympia, our state capital, was to say, what would happen if we trusted our community? What would happen if we said, you know, they're not so traumatized that they can't participate in anything. They actually are, I also have problems with the word resilience, but they actually are resiliently just taking this as, this is the thing of the day that we have to deal with. And so as the thing of the day, we are going to come up with solutions to make sure that pleasure and joy, which are just as much our birthright as everyone else here, are centered in the solutions that we have. So with that, I'm going to ask you to meditate with me for just a minute on the non-rhetorical question of what would happen if we considered that the offspring of King Cotton and Queen Sugar was a child named Pleasure. So I'm going to ask you to close your eyes for a moment, trust a little bit, and I'll read you a little bit of prose from J. Ruth Gendler on what is pleasure. Some people are more accustomed to pulling up the dictionary. I tend to go to poetry and prose to define words. So consider, pleasure is wild and sweet. She likes purple flowers. She loves the sun and the wind and the night sky. She carries a silver bowl full of liquid moonlight. She has a cat named Midnight with stars on his paws. Many people mistrust pleasure and even more misunderstand her. For a long time, I could hardly stand to be in the same room with her. I went to sleep early to avoid her. I thought she was a gossip and a flirt and she drank too much. In school, we learned she was dangerous and I was sure that she would distract me from my work. I didn't realize she could nurture me. I didn't realize she was the work. As I have changed, pleasure has changed. I have learned to value her friendship. Keep your eyes closed just a little longer as you think about what would it taste like? What would it feel like? What would it smell like? What would your neighborhood look like if it were centered around pleasure as opposed to trauma mitigation? What would it look like in the Black communities of the places you come from if we centered on pleasure and joy as opposed to trauma mitigation? As you're ready, please open your eyes. And I'll give you a few examples of what that pleasure looks like in Seattle. So one way that that pleasure has come to be is that at the beginning of the pandemic, as you might know, imagine, have read about, Seattle is home of places like Microsoft and Amazon and lots of tech spaces that have the resources to tackle the big problems of the day. At that point in time, at the pandemic, it was, we're going to go to remote learning. And so how do we get laptops? How do we get Wi-Fi hotspots into the hands of students? And our students from those most impacted communities said, I don't care if you get me a laptop. First of all, I'm a digital native, and so I do everything on my phone. So what is a laptop? And then secondly, I can't even get out of bed in the morning. I am so depressed. I'm so anxious. I am so disconnected from your belief that education is the thing I should be most concerned about right now, when really I'm worried about, is my mom going to make it? Is my dad going to get out of the hospital? Is my grandfather going to be able to pick me up after I get back from whatever care environment that was still barely working at that point in time? And so we said, okay, well, what would you do? What is it that you need? And before the pandemic, we knew that mental health services were a bit abysmal, particularly for youth in our region. They complained about things like, one, long wait lists, not being able to work with folks who looked like them and understood their life experience. So they spent a lot of time just describing their neighborhoods and their conditions before ever getting any mental health support. And so when we said, well, what would be different for you? They were like, trust us. Trust us to hold circle, trust us to work in community, trust us to be together and to help each other out. And our public health service, through our Best Starts for Kids grant funding, was able to, in bit of Titanic ways, where it was really hard to turn a big ship really quickly in the ways that we needed to, was able to say, well, let's pilot some things. And so we were able to pilot a youth healing project where the youth were the ones who decided, this is what we need to have happen for our healing. This is what we need to get through this pandemic. Like, you're telling us we need laptops. We're telling you, no, we don't need laptops. What we need are to be together with other people in ways that are innovative. And so that innovation space, innovation is another word that I sometimes struggle a little bit with, but we opened up the space for the youth to be able to connect back to their ancestral ways of knowing. It wasn't necessarily an innovation. There was nothing new under the sun, really, but it was about returning back to ancestral ways of being and making space for that to happen in our policymaking. Got tons more examples. I know we're pressed for time for today, but I really do hope that you will take that question of, what would it mean? What would it taste like? What would it feel like? What would it smell like? What would it look like for us to prioritize pleasure and joy in our city responses to really catastrophic times, as opposed to trauma mediation? And where might we come up with much more innovative and much more ancestrally connected ways of doing different in our policymaking if we started from that premise instead? Thanks.
Thank you. Another wonderful talk. And that kind of reminded me that urbanists spend a lot of time critiquing. There's much less politics of hope. So perhaps that's something we can think about. Thank you. So now we're going to hear from Dr. Mardell McCuskey-Shepley. Dr. Shepley is a professor at Cornell University in the Department of Human-Centered Design. She is Executive Director of the Cornell Institute for Health Futures. Previously, she served as a professor at Texas A&M University and was director of the TAMU Center for Health Systems and Design from 2004 to 2014. Mardell is a fellow in the American Institute of Architects and the American College of Healthcare Architects. So welcome, Dr. Shepley.
Oh, good. Just what I was hoping. So people sometimes wonder why an architect is engaged in research. And my motivation is to provide the environments that suit the people for whom we have designed them. And you'd be probably surprised how often that goes by the wayside. So this particular project was motivated by my concern about gun violence we've experienced in our country and other parts of the world, and what can designers do to help mitigate that. I just want to acknowledge the team of people. I'm going to summarize this research project quickly, then tell you about the next few ones we're working on. Acknowledge the participation of my team members. This is a, how do I progress on this? Got it. It was right in the middle. So then I got to do some design research on this. Okay, if the designer can't figure it out, it looked like a flag, and there was a star down here. It was pretty exciting. All right, so question is, I pose it right here. Can design help to solve the gun violence epidemic? We know a lot about, so speaking to your issue, what would I do based on my motivation right now to provide joy would be to provide access to nature and places within that natural environment for people to build their cultural settings to help them feel supported. So we do many studies indicating that when you have access to nature, there are health benefits, including stress reduction and other things, and that introduction of some of these spaces is particularly crucial in some communities. There are people who have worked on this beforehand. In these studies that looked at residential housing, some with gardens, some with not. And then this kind of summary that says, if you have a lot of, you have low vegetation, your crimes go up. So we do know that this is the case. And what we wanted to do was, and another example of the type of intervention people will do. So we knew this was generally the case, but the literature out there is quite broad. And so we wound up doing a classic systematic review. Actually, it was a more of a review, a scoping review, they would call it, because we wound up looking at 40,000 papers that were related to this. So you imagine when you put in, even if you put in architecture, people talk about the architecture of the neuron, but you have to sort of narrow in on this. We wound up 2 people working in parallel, not consulting with one another, identifying these papers, and I was sort of the deal breaker. It took us over 2 years to actually do this process and came up with 45. And rather than, this gives you an overview, what I'm going to show you briefly next. And there, we looked at 5 kinds of green space and all violent crime, and then crime involving homicides and not homicide. So what I would say is, one reason we do this is people know that parks are good. If we can demonstrate that by building a park, you can actually save the city money, all of a sudden people go, oh, okay, that's good. So we also look at the return on investment, and sometimes a single murder can cost a city up to $500,000. So think what you could do with just creating a community park using that same amount of money apart from the other kinds of activities. So parks are hard to evaluate because they are so different, and because you can't do have a non-park and then a park, because parks take a long time to grow. So the results on parks are pretty split. So if it says down, that means crime is down. Three helping with reducing crime, and 3 increasing it. Community gardens turn out to be, talk about places of joy. Community gardens turn out to be a place that really have a big impact on a neighborhood. So you can see that there was 6 studies found that crime went down in neighborhoods that had these community gardens, and introduced pre and post. And that was something you could do and look at over time. Just putting trees along a street and some grass and a place to sit on a corner had this very important impact. So you can see 4 of the studies wound up saying crime went down. All these things have to be done in the context of the neighborhood and what the community wants. So sometimes people have had these programs that have not worked out because they have not had buy-in. So this is all community collaborative work. Ground cover, lots of studies on this, because basically this means you look at GIS data and you can see where the parks are, and you can compare that to census areas with crime. And we know where there's more green space, there tends to be less crime, significantly less. For undeveloped green areas, this was sort of a non-starter because they are so varied, and because they often are more associated with more rural areas. So our issue is, okay, we know this is happening, but why is it happening? And so what are the possible mediators between presence of green space and crime? So we sort of brainstormed, made up these 6 ideas, and then I'll explore them a little. But our current project is, we have 2 grants out seeking support to pay significant salaries to members of the community to serve jointly with us as researchers on this project. And so those of you that are aware of communities that have had green installations, I'd love if you'd approach me, because I'd like to give them the opportunity to $10,000, $20,000 a year salary would significantly help their ability to participate, rather than be leaning on them to try and do all this extra work. So places for community interaction, basically you create this particular space. People are going to wind up coming there and meeting one another and establishing knowledge of their neighbors, places to exercise, lots of data about how you exercise enhances your mental health perspective, both psychological and physical. How many people here have heard the term biophilia? So a couple of hands went up. The other day I saw it being advertised in one of the gas pumps when I was getting gas. I thought, oh, our time has come. So biophilia essentially our innate affiliation with nature. We evolved understanding nature. By understanding nature, we are more likely to survive. That's the essential idea behind that. So there are lots of things associated with that, like look at water, your blood pressure drops. Steve Kaplan did a lot of work on the restorative aspects of nature. So if you're talking about, it's not joy exactly, but if you are focusing on a very difficult problem, even 10 minutes, 3 times a week in nature, focusing on nature alone will modify your mental health perspective. And there are several studies that support that. Territoriality, very controversial area when you look at the theory of broken windows, but essentially the issue is if a territory, it's not clear who owns that territory, it's up for grabs. And that creates a dynamic that might not go well. Community cohesion, if you receive support from your local government to have these interventions, that is a message to your community and perhaps make you start to feel about your neighbors as being part of a collective trying to accomplish something. And the last one is climate modulation. And so that I know a lot of people here are interested in climate. In fact, if you have green space, you don't have the heat island effect, the radiating heat that comes off the tarmac and the concrete and all of that. And also that the leaves themselves tend to filter particulate out of the air. So that may be contributing to it. So where we are now, it's my last slide, where we are now is trying to get this money to get support from the communities. We also did a study where we took 9 of those 45, we took all their data, put it together, did a meta-analysis and reanalyzed it, and then found we had positive results. And then we tried to calibrate the dollars saved because we want this to go out to municipalities so they know what's going on, so they would feel free to implement some of these changes. So thank you very much.
Thank you. Fascinating again. Thank you very much. Okay, finally, we're going to hear from Dr. Andre Perry, a senior fellow at Brookings Metro and a scholar in residence at American University, a nationally known and respected commentator on race, structural inequality in education. Perry is the author of the book, Know Your Price, Valuing Black Lives and Property in America's Black Cities. Perry's recent scholarship at Brookings has analysed Black majority cities and institutions in America, focusing on valuable assets worthy of increased investment. Welcome, Dr. Perry.
Thank you very much, and thank you, BU, for all your support. I actually will talk about this research that I'm about to present to you. It was first seen through the Emancipator, which is a collaboration between Boston University and the Center for Anti-Racist Research. And so this is my second time with BU presenting today. But as was stated, oh, let me go back. I study Black majority cities, places where the share of the Black population is 50% or higher. And you can see there are a lot of them. There are more than 1,200 throughout the United States. Most are concentrated in South, but you can see they move up the Eastern Seaboard. I think there are a few left out West, but those are diminishing in numbers. I study the assets within each and every single one of those dots, the homes, the infrastructure, the businesses, the things that if you invested in, you would see economic and social mobility. But today I'm going to focus on life expectancy. And the reason why should be clear, obvious to everyone here, that it encapsulates the non-biological and biological factors in our lives. Now, I'm going to show you the Black Progress Index. Now, it's an interactive dashboard that allows us to see those social factors, not the biological ones, but the social factors. It came through a partnership with the NAACP. And our mission is to strengthen the assets in those dots I showed you earlier that will increase life expectancy and well-being. But we want to look at strength. We want to look at the places where people are living well. And so rhetorically and practically, we want to find out where are solutions. If racism is a given and it's occurring all across the United States, the places where people are thriving can give us an indication how people are beating racism back. So that's the theoretical engine behind this research, and I encourage everyone to get online and go through the index themselves. You can click on your metro or county to see your outcomes, and I'm going to show you a little bit of the Boston area outcomes. But I failed to mention my colleague Jonathan Rothwell of Gallup, who's been my writing partner on this project and my writing partner over the last few years. Okay, and I mentioned some of this. Again, the emphasis is placed on strength, and differences in life expectancy are assumed to reflect the efficacy of different civic actions. So, I mean, it is my fundamental belief that people are creating better conditions. Just some of the methods we downloaded as many databases as possible, from US Census to Fed Reserve databases, Facebook databases, Redfin. So, and then because we use machine learning algorithm to analyze those variables, as many people in this room know, that it just allows you to, particularly if you're taking an atheoretical approach like we did, just to look at as many variables impact on a dependent variable. We looked at life expectancy at birth. Then we categorize those variables in specific areas, and I'll show you what those are. This is what the dashboard, the initial index looks like. Again, you can go on that first dial is what we expect. It's a predictive model. This is life expectancy for Black people. And on the right dial is the actual. So our model was highly predictive. You can look at the paper to see our R values, but very highly predictable. On the far right, those are the most influential factors on life expectancy. Again, this is an atheoretical model. We essentially threw everything in the pot and found what's the most influential factors on life expectancy. And I'm going to go through those lines. But three of the variables won't surprise anyone here: median household income, home ownership rates, and business ownership rate. That was a factor. So business ownership is actually good for our health. Some of the social and human capital things. Now, this one may surprise people. The share of Black foreign born. The higher percentage of Black foreign born, the more predictive and additive it is on life expectancy. Some of the others will not surprise: performance on math scores, higher education attainment. We found that your social network. So we infused the Facebook data, and we found the mean distance of your Facebook friends in a county or a region with a positive impact on life expectancy, or predictive positively on life expectancy. Now, what was negative, which is a little surprising, is religiosity, and that's measured by the memberships divided by the population. Now, I'll just briefly talk about that, because the last time I presented this, I got a lot of tomatoes thrown at me somewhat. But in general, remember, this is correlation, not causation. Going to church doesn't necessarily cause you cause a region to have lower health outcomes. But we generally know that church goers are more likely to be obese. But I also think that there's a suffering that people or suffering that occurs that compels people to go to church. So people may be hurt going to church. And then I do believe that this idea of giving it all up to God, putting it all in Jesus' hands, so to speak, is is antithetical to positive health behaviors. But that's something we're going to explore in the future. Each one of these sectors deserves deeper exploration for sure. Oh, safety, gun-related fatalities with a negative drag on life expectancy. No real surprises there. It really popped as one of the biggest negative drags on life expectancy. Walkability was a positive. So if you live in walkable neighborhoods, if we have a lot of that, so it's positive on life expectancy. Again, I don't think that's a surprise. Family health, when we do not share around family composition. Again, this is not to blame or to say cause, but it did pop on in terms of predictability for life expectancy. Children who don't live with their father. Now, clearly, you saw income as one of the positive predictors. Without question, we see Black fathers actually spending as much time with their children as other parents. However, the separation from fathers and sons really divides income and wealth in significant ways that have a drag on life expectancy. And in the environment, two variables, again, were highly predictive. Air pollution takes away years of life, and population density. This is interesting because a lot of urbanists really see the value in density. However, for Black life expectancy, it was negative. I'll briefly give some commentary on that. I think the innovation, the social things that come along with density are essentially being blocked. So segregation is real in our highly dense communities. And you can see here the strength of each. Percent of Black foreign born, highly predictive. Home ownership rates are high. And then going down to the negative, we have Black firearm fatalities and religious adherence per capita. So I want everyone to just dig deep and look at and speculate, because what we want to do is really ask why these things emerged. I'm just going to close out with some Boston numbers. Again, this is comparing Black people to Black people throughout the country. Black people in Boston are living a long time. Close to, so we predicted 79. It's actually, so that's very close. Close to 80 years old here in Boston. Again, there are lots of places, hundreds of counties where Black people are living well over national averages, well over. Again, when you look at compare Black people to white people constantly in the aggregate, it masks what's going on in the local communities. My goal is to go to these places, say what's going on, because if you pay attention, some New York, that's Brooklyn. People are living long in Brooklyn, and there's Democratic places, there's Republican places, there's large and there's small. So that provides me with that suggests to me that people are making differences, are having impact on their own well-being. Now, here's the flip side. There are lots of places where life expectancy is well under 70, well under 70. And you can really see in terms of environmental issues, in terms of gun fatality, in terms of home ownership, just low on, they perform low in each and every one of those areas. And so, but here, I just want to point out, and just to re-emphasize the point, if you go back, there is no way a Black people are different across the country, biologically speaking, but we're seeing wildly different outcomes. And this is a map, dark purple shows you where people are living longer. A light purple is where people are living less. You can see in the South, people are struggling. I don't think that's a coincidence to the history and the resources put into the things that we talked about today. Let's see, Boston area wealth, man, 92nd percentile in income, but in terms of home ownership, fairly low. So there's an area that I think there's an opportunity for growth. You got the income, but not necessarily the home ownership, and black business ownership rate is high. So again, that's an area where I would love to animate those positives by addressing that negative. Human capital, higher education rate here is high for Black people. Elementary school performance, decent, not the best. Facebook friends distance, very high. Religiosity is high, but it seems like those other areas mitigate the negative impacts. And the share of foreign born, very high here. And it certainly is a place for higher education. That's understandable. And then I'm going to close out. Low in gun fatalities. This is per 100,000, just very low. And again, a lot of places wherever I go talk about these data and they say, oh, gun violence is a problem. And I want people just to see relative to other Black places, maybe not. I mean, every shooting death matters. It's a cost on municipal finances, on families, emotions, but there, some places are doing a lot better around these issues than others. And so we just need to pay attention to that. And then family health, more than half of Black fathers, and I'm not trying to make a normative statement here. More than half of Black fathers actually live with their children, which is higher than most places. I mean, much higher than most places around the country. And then in the environment, it's not as bad in terms of population. I mean, in terms of air pollution, not great. And then density is highly dense here. And then this is what we ultimately found. This is what it looks like in Boston, 79, close to 80 years old. And so, but on many places, we emphasize this. I really like to look at this left-hand side box. If you score what your expected score, whether it's significantly higher or lower, or no, I'm sorry, I should say the second dial in the box. If the actual is significantly higher, that's a good thing. You're beating expectations. If it's significantly lower, that's a problem. And certainly that could be a result of error. That's, but we're looking at those places in a qualitative way to say what's going on in those places where not only are people living longer, but they're beating expectations. So with that, I thank you for running over, but thanks a lot.
Okay, thank you very much, Dr. Perry. Okay, so we're now going to invite all the panelists to join us up on stage on these very high chairs. And what we're going to do, I think, is start off having a discussion with the panel and then maybe open to the people in the room if they want to ask any questions. So. Is this turned on? It is now. Okay. Great. Okay, so I'm really looking forward to this discussion. I hope everybody else is. Hope you guys are. Absolutely wonderful set of different presentations. But I think there's one thing that's stuck out for me that I'd like to kind of put on the table, and that is the value of an intersectional approach to dealing with issues around, and you guys have talked about displacement, safety, equity in cities. So intersectionality around race, class, gender, age, etc., etc. So where do I want to start? Shall I start here?
Oh, I'll start. Mary Rowe, we met in New Orleans right after Katrina. I was a professor in the University of New Orleans, and how I actually started writing about all these other things is because I actually got sick of people saying, if we could only fix the schools, everything will be all right. And when you look at how schools are funded, you got to talk about housing. When you look at the workforce, When you look at environmental issues, it's not just about the schools, and it's not just about any one sector, any one person. It's about really seeing how these sectors connect. I used to say all the time, and I meant this, kids don't live in schools, they live in communities. And if you were really interested in education, you would deal with all those factors in an intersectional way. We have enough experts who can walk and chew gum at the same time. But in many, from an institutional perspective, you have school leaders, public safety leaders, you have the business community that never talk to each other. And so for me, I want people who can make the connections across age, race, sectors. It's really taking an interdisciplinary, intersectional approach to addressing these very complicated problems.
Yeah, ditto, basically all of that. Intersectionality in my work often looks at identity issues of individuals and communities. And so looking exactly at those things, like I will be the first to admit that I'm kind of a one-trick pony. I lead with race, and that is where I start. But in the context of intersectionality, race often gets left out. Like we want to disaggregate by everything that says that acts as a proxy to race without ever talking about race. And so that space of really being truly intersectional and looking at like, what is the difference between a foreign-born Black person and a person who is generationally connected to enslaved people in this country as a Black person, and what are those differences? And where are the similarities that come up in there is really important in talking about and being intersectional in the work that we do.
Right. So intersections can go so many directions. And one way I'm playing it now, I'm thinking about participants in the process, is that profound community engagement. I don't mean just asking people questions, profoundly integrating them. But my research team, on that team, there's a environmental psychologist, a landscape architect, an engineer. We no longer can operate in a world where one discipline can answer all these questions. And each of these individuals sort of takes responsibility for all these intersections and bringing their expertise, because no one of us can really manage all of it. So sometimes we live in a world where people tend to want us to specialize. I think that's probably not going to be useful in facing the wicked problems that we all address.
Yeah, and I would add that, the instinct to specialize and the reliance on expertise, and this is what our institutions are built on. And if you go back to the progressive era where we reformed city government, we had commissions of experts, and we had a civil service that then promoted experts in every department. And then you echo this in academia, where to get tenure, you have to have expertise in your own narrow discipline in a very niche area that you add value, you add new knowledge, and you have to show that you can add a new knowledge in that specialized area. So our institutions are really set up to be balkanized, and we're not going to move forward until we can actually reform those institutions to overcome those silos.
Yeah, and I think it's really important that we talk about interdisciplinarity. We talk about the crossover between policy, practice, academia, three kind of bodies that rarely speak to each other, but actually it's events like this that enable us to bring them together and are quite important. So my second kind of trigger question, not really a question, but it's to get you guys thinking. The other thing that struck me from all of your talks was the centrality of mental health, and you even talked about it with religiosity and stuff. So obviously we're in a kind of mental health crisis, particularly post-COVID in cities, particularly amongst young people. Mental health issues have escalated, and they're around a whole host of different reasons why they've happened. What do you see as the solutions to that from your own personal perspectives, according to what you've talked about today?
Well, I think mine was, I think I sort of expressed
green space.
Pretty self-explanatory, that my notion is to use green space as a way of addressing mental health. As architects, we have these huge egos. We think the physical environment can solve everything. Clearly, one of the slides I saw that maybe it was the previous session, where only 10% of the contributors to health were associated with the physical environment. Of course, I feel like the physical environment creates the setting for everything else you want to do. So it may have a greater role than that, but it is all my experience right now supports this, particularly in people I see in underserved settings and in academic settings, students, huge struggle going on right now.
Yeah, one of the really great outcomes of our Youth Healing Project was just the trust that was built of the so-called experts, the niche folks who are like, I know how to fix your mental health, listening to the people we were trying to say, hey, we want to fix your mental health. And so going to youth, particularly youth who are not typically the youth that we go to, opportunity youth, which is a very niche term around 16 to 24-year-olds who have kind of been pushed out of the system. And so the system itself wasn't serving them even before the pandemic. But the way that our experts and our systems opened up to say, like, we actually don't know what the answer is in this moment, and trusted our community of youth who said, well, this is the answer, let's try this on, and actually allowed for much more grace for things to not go perfectly and not to like get the exact outcomes that they wanted, that youth are still involved to this day, and our county government is still involved, and our public health system is still involved in. How do we evolve that, and how do we learn from that has been a really core part of just unintentionally impacting mental health, where people feel trusted now. They feel like they belong. They feel like they're part of the system. They feel like they're part of the community of solution makers. And before, they felt like they were on the outside looking in, being done upon.
I just, in Mary's talk, she talked about effects of the COVID pandemic and what we've learned from it, and effects. And I have to think that we've all become a lot more compassionate. I mean, we had endless emails during the pandemic from our deans. You don't worry about your tenure clock. Oh, you want to have a baby? Please go ahead. Take years. And the same thing with the schools. They're like, oh, we understand it's going to take you a long time to complete this assignment. And so, my daughter is still like, oh, I don't have to finish that. There's always an extension. I'm like, this is not real life, please. But that compassion. I mean, so we learned compassion, but we didn't really apply it yet to how we think about city building. And more broadly, how do we build compassionate cities? So I think there's an opportunity to kind of leverage that to kind of extend the learned compassion into how we plan and build our cities.
I wanted to add a couple other things related to the environment that ties some of this together. I think providing mental health services in communities is so much better than bringing people into emergency rooms in large hospitals. And that is a trend that we're seeing. And a lot of those people can be deviated from entering the system because they are treated early on. The other possibility is providing services in the schools so that young people have individuals to go to, then allocating space within these school programs for healthcare providers to come in and provide the care more directly.
No, I'm going to answer this a little bit differently. I really want to send a message to the public health professionals out there. Lots of them are struggling because this last 2 years have been very difficult. And in general, people who are working on racism, sexism, homophobia, and things like that, they also are suffering from, they're in a mental health crisis. And so I think the power of convenings like this is to have us recognize that we have to work together for our own mental stability, that there are many professionals who are on an island. When you're leading a health department in LA, I mean, you need to have support, not just a staff. You need, a real safety net for yourself. And so for me, what I see, and this is purely anecdotal, what I see a lot of public health professionals who are struggling with their mental health. And we're always trying to help others. But, I do think that convenings like this is an opportunity for us to see the power of networks and working together.
Yeah, no, that's wonderful. So I guess one other thing I've been thinking about, so you guys are quite different. Some of you've got very kind of individualized bottom-up approaches, grassroots approaches, community approaches, and others are more kind of top-down from an urban designer, architect, city planner point of view. How do we mediate those two scales? How do we come together somewhere along the way that we can create an inclusive, more inclusive, safer set of cities?
Well, I will say when I met Mary Rowe in New Orleans, there was a wonderful opportunity to pull all these things together, and we failed as a community. We had an opportunity to really to make a different New Orleans from, you know, the spaces we created, the schools we did rebuild rebuild new schools. But we essentially went back to the same models we had in the past. And I see this last pandemic as we had another opportunity to really transform the social safety net. And we did in some cases. When you're talking about the child tax credit, when you're talking about unemployment insurance, these were like important things we should have held on to. And I fear that when we have these opportunities to move forward, we don't take advantage. But I think it's not like during these emergent type situations, we can bring in the structural people and the grassroots organizers at the table. It's always tough, but I think even we're still in this period where we can do that, where we can actually see, hey, we need to build affordable housing. We have resources that we're seeing. How can we address the needs of folks on the ground today? And for me, I just think these emergent type situations are the opportunities for people to come together, from the research folks, the architects, the builders, to the grassroots organizers.
I really love your focus on the emergent. As a loving emergent strategist, we know you have to bring together the people who have the expertise and access to power, along with the people who are impacted and have the ideas, because it's not to put it down into a binary like that, like neither of those can cross over. But what we recognize both with our Youth Healing Project and now with the city of Seattle turning to us as one of those intermediaries who can take a bigger chunk of funds and then get it down to like the Black Student Union at the Auburn High School to like do the things that are going to be impactful in community. For us, it's this vulnerable opening of trust that public health officer saying, I don't know the answer, and not feeling like they're going to lose their job because they don't know the answer and they don't have the researched way of doing things. And that opens up that space of trust with our youth who say, okay, you're coming to me as an expert in my life to say that I can help you. And together we can symbiotically get through this space. And so the city of Seattle, through their Best Starts for Kids program, not only looked at the Youth Healing Project and was like, wow, that was a really great pilot. Let's actually make it into a program and let's move forward with that. But the city of Seattle itself is like, hey, you have really great access to the youth who are in our community who we're trying to actually do well by, and you have the expertise in being able to like really elevate their voices. How can we bring them together in a space where we're actually not just inviting them to our tables, but we're like saying, maybe we need to go to their tables instead and turning those tables a bit.
This is not unlike the effort I'm trying to go through now, where I erase the line between the academic and the community member, where we are part of the same team and treated as equals. Mm-hmm. So I think that is, I feel like, I know it seems like it's opposite ends, but I'm not sure things aren't just sort of circling around, coming together in some place because of the dire need to make progress and people's enthusiasm for trying to address these issues. I see this as a very hopeful time, and I see in my students, they're interested in being engaged at all levels, and I'm hoping the next generation do better than mine.
So I'm going to take this in a little different direction. You know, in the last panel, I was chafing at the bit a little bit when we were talking about innovation and the local level, which I totally agree with. It's all going to be happening at the community level, all the new ideas that emerge locally. That said, you need that top-down structure in order to empower them and to spread them. So for instance, wonderful regional experiments around the country led to Obama administration doing the Sustainable Communities Initiative, which funded regional experimentation across 50 different regions. And you had you have examples in California, community land trusts, experimentations at the local level, very successful new model, or not so new, but now really starting to think about it for affordable housing creation in the core of our cities. Now the state is saying, well, how can we put community land trusts into our state legislation so that whenever you build a transit line, you have to build a community land trust. You have to purchase the land around it and keep it for the community in perpetuity. And so you have that kind of bottom up, top down. And you can even look at the state of California as being the bottom up, changing the mileage regulations, right? And then the rest of the country has to follow suit, and the national government has to follow suit. California's environmental regulations, innovation at the bottom, and then replication via channeling to the national level.
Right. And I'm not sure architecture's on top. We may be the bottom. And just to flip the paradigm around a little bit.
I mean, I think you're all right, kind of bringing the top and the bottom together, but I guess the gritty bit is the bit in between. A, how do you do that? B, what are the ethics of doing that? C, it's not just at a moment in time, it has to be longitudinal. And to build the trust you're talking about, it has to be longitudinal and ongoing. You can't just dump people once you've got your results. And also, in my mind, from doing a lot of work around the world on kind of community planning and collaboration, it's the kind of institutionalization of it. And once it becomes institutionalized, it plays out in a different way, and it just becomes a kind of tick box add-on rather than actually being what you do want, which is organic grassroots input. So that's just some thoughts. But I'm going to open it up now to the room. And is there any questions anybody is desperate to ask? Or even points they would like to make? Okay. We have a microphone appearing.
Well, first of all, thank you to everybody. It was really interesting. A question to the whole panel, but maybe Dr. Perry, you first, because you inspired the question. You showed the data about the tremendous health gaps and the health achievement across different parts of the country. One can obviously talk about the world. And I feel like in both this morning's panel and this afternoon's panel, one of the dangers of sort of conversations like this is we're sort of like homogenizing. We're saying like cities, as though the problems were the same everywhere, as though everything's the same everywhere. But in fact, when you have a 20-year life expectancy gap, things are not the same everywhere. Right. And and you show the Boston, Newton, Cambridge area, which I think one interpretation of that would be we're not doing too badly actually here, right, by sharp contrast with other parts of the country. So I was wondering if you could comment, maybe everybody else can actually comment a little bit about that, about the different challenges that are faced by different cities, different urban areas, intranational as well as international, and how that sharpens our thinking about what needs to be done.
Yeah, I've been thinking about that a lot, because it is clear people of color are not a monolith. Black people are not a monolith. Brown folk are not a monolith. And we are in wildly different contexts. If you are Black and you live in Jackson, Mississippi, the strategies for improvement are vastly different than if you're in Cambridge, Massachusetts. But our metrics often mask those different realities. And in somewhat of a debate with one of my colleagues, they wanted me to not take sort of the pressure off of showing racial disparities, because when you compare Black to white, you keep that pressure on. But see, I have a greater fear. I worry that if we don't share how people are changing environments in various contexts, we don't encourage those places where outcomes are worse, and we don't have people communicate in different places. People in Jackson need to communicate with Black people in Boston. Black people in Boston need to communicate with Black people in Pittsburgh. There are certainly related things and that we can draw from. I joke to say if there is a Wakanda in the United States, it's the DMV, it's Washington, D.C., right? Like that area, but Washington, D.C. actually has the worst outcomes among the cities. But if you live in Montgomery County, 80, you more likely to own a home. That just didn't come because of the federal government is there. And I also believe while you can't place a federal government in every city, you can understand what benefits workers get, what insurances they get, what kind of housing programs are there. I just think that there's a lot of cross-pollination that we can have, but we first have to recognize that we're not all dealing with the same issue at the same time. It is not true. And just one more thing, because I just presented to my hometown of Pittsburgh, Pennsylvania, and there was a report out that said it was the worst place in America for Black women. And I said, that is not true. That is not true. Because I also, this is the other fear that I have, that we in order to create a sense of emergency, we show racial disparities in a way that says that that there's almost impossible to overcome, like in a way this is, it doesn't show the opportunities for growth. And I am a structural racism writer. That's all I do. With that said, I see hope in a lot of places. I see change in a lot of places. And I see opportunities to learn from the areas, from the activists, from the scholars, from the folks who really doing interesting things, to say, hey, did you talk to this person over here? Maybe there's a strategy that can take place. So for me, I don't want to portray a story that is so homogenous that it hides the very real differences that people are experiencing and the positive impacts that people are having in different parts of the country.
At the end of the day, I think that certainly with youth, but probably with all of us in this room, when you have the idea, when you're into the idea, you're more likely to follow through on the idea. And so for me, it isn't so much like, do we need a very specific program, like a youth healing project? How do we go establish a youth healing project in every other city and like do something like that? It is more the mud of the, how do you bring people together? It's that kind of strategizing that I think is really important when you're talking about what does it look like across different cities? What does it look like across the globe to do things differently? Like, what is the strategy around building that trust so that you can sit at the table together, so that you come up with the solution that fits for your city, which may not be a youth healing project. It may be something completely different, or it may be a riff or an iteration on that. But because you got to come together and come up with that solution, you're more bought in, you're more likely to make it sustainable, as opposed to, oh, y'all brought in that Oakland project over here and we'll do it for as long as you're here, but as soon as y'all leave, we're going to let that go.
I'll just add on the dangers of homogeneity in policy making. I really what I'm concerned about in academia is the hegemony of the United States and United States Academy and policy views, and the U.S. prescriptions that we've come up with are so clearly inappropriate, and there's so much to be learned from other parts of the world. It's so much of a need for humility, and I'm very concerned that the U.S. in particular has closed its borders in a way in the last few years that needs to be completely reversed to rebuild a lot of those in international collaborations and to bring in different types of viewpoints into academia. So anyway.
Not much to add. You're making me think, okay, this next green project I'm going to make sure I'm working with local adolescents to get their input about what they want. I mean, that's part of the philosophy behind all of this. And these same individuals, these adolescents, the adults, they contribute to the questions that we ask. So it's really broadly based, but yeah, thank you all for your comments.
Thank you. Yeah.
And I just have a couple of quick things. One is to remind us all.
Do you know, just hang on, wait for your mic.
Cities are slow, right? I mean, we're all urgent, and I hear you, Andre. I mean, I look back at 17 years ago that we landed ourselves in New Orleans, and sure, there was disappointment, but cities are, to use the good and bad use of the term resilient, it takes a lot to kill a city. They hang on and they evolve over hundreds of years. So we just need to remind ourselves, like water with a stone, you know, change happens, but it happens over time. Second thing I would say is that I think peer-to-peer learning on cities, the horizontal piece, which neither Canada or the United States does very well, is the critical way that change happens and change happens more quickly. So just as you were suggesting, Black people in Pittsburgh, Black people in Brooklyn, same with city builders of any particular description, learning from each other. And it's back to that notion of where somebody somewhere is doing it right. Somebody somewhere is doing it well. And how do we amplify and learn from each other, mimic like crazy, try stuff, and not allow academia or expertise or top-down rules to squelch the kind of informal way that what was the expression you used, Bernadette, about being digital native? Mm-hmm. Kids have contacts and networks all over the place. So they are exchanging already, and we just have to catch up and bring all of our city building practice so that we can learn that quickly and adapt that quickly.
And I think one other thing that they're not afraid of is they're not afraid of the failure space, right? And so it isn't that I have to find the place that's doing it perfectly or who is doing it best. I need to find a place that's doing it better than what we're doing so that we can know what the next step is.
And actually learn from policy failure as well, which is part of the bargain. So on the other hand, I'm also conscious, I'm not sure what am I supposed to be doing with time? 5 more minutes, okay. Sorry, put your hands up again. Go to this question and then this question.
Hi, I'm Dan Merrigan. I'm on the faculty here at the School of Public Health, and I've totally enjoyed this morning's panel and this afternoon. Thank you. I know a lot of my colleagues are very on board in terms of the importance of intersectionality and systems thinking and the importance of the, emergent thinking that comes from collective impact and getting out of our silos. And I think that's been much a theme that's been talked about today. When you spoke about studying the Blacks and the two populations of Black and your you know, the health index that you were speaking about, I was thinking, I think many people are aware that we have to work collaboratively across interdisciplinary lines to get to solutions at the local level. But I think really there's still a huge gap in the data that at the local level, the granular data that we need. If we talk about great disparities within a municipality or even greater disparities within a neighborhood, we're in the South End in Boston right now. We have very, very affluent people and we have people who are doing very, very poorly. And I know there are a lot of national initiatives like like county health rankings and that sort of thing where we can compare counties, but there's not much to look at a lot of the social environment, the economic environment, the built environment, the social and service environment at the very local level. And so it's hard to do community health improvement planning. And I just would want to put throw a shout out that I know in Southern California, there's a health improvement index. And I know very recently Utah has brought in some consultants and they've created a community health improvement index that we can use to better analyze the problems and where we need to put emphases. And I'm just wondering from a city planning and the perspectives that you're representing, what your thoughts are about access to granular data.
I mean, I think your question goes to what Karen was saying about the lack of data on housing. Which, do you want to respond, Karen? Not putting you on the spot or anything.
Yeah, I think it's going to have to come from collaboration between health researchers and the community planners and housers. Right now we're starting to work with individual data. Right now we're purchasing it. And so there's tremendous proprietary databases that can then be linked with health databases and start to show some of those links between the built environment and health outcomes. And so that it's, again, we're still kind of in the Wild West in terms of moving that forward.
We are in the Wild West as well, as the data warehouse for a lot of the education data in our state. We have long lusted after, what does it mean for us to, like, everything is an app nowadays. Like, why is there not an app that parents can log into to say, my kid is not going to be at school today for these selected reasons or other, so that we can automatically deploy someone to their house to, like, help with the issue. They're not coming to school because they don't have a ride. Hey, here's your ride kind of space. And so we it's kind of two-pronged. On one prong, it's the big data that we have access to is just so outdated based off of the populations we're surveying. We're having a lot of conversation around what even disaggregated data looks like and what is Black. And so that is a whole situation that we're dealing with. And then there's the other space of, like, in this digital native time where so many of those kids are quickly on their phone, why can't we more quickly be able to deploy resources into a community to say, hey, you guys think you have COVID? Here's some tests for you. Here's this, here's that, so that we can make sure that they are getting the resources they need in a much more real-time access than 3 weeks later, we find out that they didn't come to school for a particular thing.
Okay, I'm very conscious of time, but we had one last question. So you okay? You're fine? Okay. Right. Well, it's my pleasure to say thank you so much. I thought that was one of the most stimulating conversations I've had in some time. And that says something. So thank you.
Thanks for the moderation.
Thank you.
Just a final note of thanks to our panelists this afternoon, as well as this morning. Thank you to Professor Lise and Fabian for excellent facilitation. And thank you to everybody being part of the conversation. Everybody have a good afternoon and good evening. Thank you.